This is the One Thing Podcast, and I'm your host, Dr. Adam Rindy. The One Thing Podcast brings together leaders in functional and naturopathic medicine to discuss actionable information that may unlock puzzles in the areas of gut health, brain health, metabolism, and longevity. Please note, these episodes do not replace the opinion of your doctor. They are not intended to diagnose or treat any condition. Please discuss this information with your provider and discuss your own unique personal health history before adapting this information. Please subscribe to our episodes so that you can stay on top of the most current information in these areas of medicine. Hello, friends. This is your host, Dr. Adam Rindy. Welcome to this week's episode of the One Thing Podcast. I'm just going to start off by saying that there are 5 psychiatric epidemics: depression, pain, anxiety, addiction, and post-traumatic stress disorder. The traditional model of treating these disorders is psychotherapy and some type of psychotropic medicine, either in combination or as a monotherapy. While this is proven to be a successful model, there are some people who are non-responders to these particular approaches. Luckily, there's been the emergence of psychedelic medicine and psychedelic-assisted psychotherapy to help fill a gap of people who may not respond due to some barriers or obstacles for them achieving breakthroughs or resolving issues in these areas and in these psychiatric disorders. In this episode, I welcome on an expert in this area, Dr. Erica Zelfand, who is a licensed family physician, naturopathic physician out of the Portland, Oregon area. She is the mastermind behind a course called The Science of Psychedelics, which is an online training course for healthcare providers and empowered individuals alike. She is a medical writer, teacher, psychedelic facilitation instructor, and she consults with clients and professionals across the globe speaking about the science of psychedelic medicine. In this episode, she walks us through sort of a 101 on psychedelic medicine, psychedelic-assisted psychotherapy. We speak about NMDA, Psilocybin, Ketamine. We speak about the mechanisms and how these work on the brain to help people with neuroplasticity, with developing the ability to make changes in their life, and addresses some of these core areas of psychiatric illness. So I hope you enjoyed this episode as much as I did. Dr. Zelfand is just a wealth of information. She's really fun to talk with. And without further ado, we'll join the episode in session. Dr. Zelfand, welcome to the One Thing Podcast. I'm so glad to be speaking with you today.
Oh, it's a pleasure. I'm really glad to be here.
Yeah, so I'd love to sort of talk about this really interesting subject and just kind of lay the land for today's discussion. But before we do that, can you just tell me a little bit about how you got into psychedelic medicine and just a little bit about your background that led you to specialize in this area?
Sure. I will say I didn't so much choose psychedelic medicine as I feel psychedelic medicine chose me. I went to medical school at the National University of Natural Medicine in Portland, Oregon. And when I was considering medical schools, I briefly considered becoming a conventional allopathic physician and pretty quickly ruled that out. And it's like, no, I just want to work on a deeper plane with people. And was really, really blessed when I learned about naturopathic medicine. And my whole time that I was at NUNM in medical school, I really thought that I was there to become a specialist in women's health and pediatrics. That was just, my Northern Star. That's what I did a lot of my rotations in and extra mentorship. I did a residency in family medicine. And I even did 4 years of postdoctoral training in pediatrics with an MD pediatrician.
Oh, wow.
Yeah. And then I got out into practice and I hung my shingle and I, did my Google AdWords, women's health, pediatrics. And I don't know what wires got crossed out there in the cosmos, but my practice ended up being full of people with depression, anxiety, addictions of all kinds, trauma, post-traumatic stress disorder, obsessive compulsive disorder, and or just, what I'm just going to call general malaise and just general existential unhappiness that may or may not have a clinical label for it. And as naturopathic physicians, we have this wonderful training in integrative medicine. So I had this wonderful toolkit in the conventional medical model, pharmaceuticals, anxiolytics, antidepressant medications. And I want to say those medications, they get a really bad rap. Because we often talk about how 30% of individuals are what we call treatment resistant. They don't respond to antidepressant medication. 30% is a lot, but if we look at the flip side of that, 70% of people do improve with those medications. So I just want to make it very clear as we're deep diving into the world of psychedelics here, in no way am I saying that there is not a place for conventional pharmaceutical treatment. I prescribe those meds. For some people, they are wonderful, and they help people increase their window of tolerance so that they're able to engage more meaningfully in their treatment and actually get better faster.
Right.
But about 30% of people don't respond to those. And in naturopathic medicine, we can look at nutrition, we can look at hormones, we can look at all different kinds of genetics, environmental exposures, all these different factors that play into mental health. But what I was finding was that there was this layer of just like a psychospiritual layer, that it didn't matter how much I propped somebody up on neurotransmitter support or how good their hormones were. If there was some kind of an imbalance in that psychospiritual layer, we were only going to get so far. And homeopathy is a beautiful healing system for getting to that layer. I'm just going to out myself here. I'm not a very good homeopath. I'm all right. I got really good training in school, and I did the New England School of Homeopathy. Just want to give a great shout out to Paul Herskew and Amy Rothenberg, brilliant homeopaths.
Yeah.
And a brilliant homeopath, I am not. I'm pretty, advanced beginner, I would say. And so there was just this layer that I couldn't get. I just couldn't access it because I'm only so good at homeopathy.
Right.
And so, as often happens in healing, healer, heal thyself, my own personal healing journey was unfolding as I was this fledgling healthcare provider. And it became pretty clear to me that, hey, psychedelic medicine is something I need to take a look at here. There's really some merit to this. And so that led to going to more conferences. It led to volunteering with the Zendo Project and Whitebird. These are organizations that do quote unquote trip sitting at festivals. And just reading, just going into PubMed and dorking out on studies. And then before I knew it, all of a sudden, I was creating a whole course and training other people on how to be facilitators of psychedelic experiences.
Yeah.
So that's kind of the not so quick nutshell of how we got to where I am now.
That's really interesting. I'd like to kind of take a slice of that process and those steps and just kind of see if I can interject just to have some questions. So you went from learning about it to teaching. And then I imagine there was like moments where you had patients that you previously had kind of reached the limit of your therapeutic offerings, that you were able to see new progress or maybe a more holistic treatment through these modalities. Were there some kind of eye-opening cases that just kind of took you from student to teacher?
Oh, absolutely. Absolutely. There's this saying, all things are connected. And, I will say I was raised in Boston. I hate that saying. I think what do you mean? No, don't be ridiculous. All things are not connected. Come on. And what my patients and clients have taught me is that maybe not everything is connected, but a heck of a lot more is connected than we think it is.
Sure.
And, we some of us experience traumas, capital T traumas, but all of us experience little traumas. There's just this trauma of living, and the bizarre and beautiful ways in which we adapt and maladapt, and these patterns that we carry with us, psychospiritually, subconsciously, and the role that can play on our physical health. And so a real turning point for me when I went from, teacher to student was when people started reporting back that not only was their mental health better and their life satisfaction better, that their physical health was improving. Chronic pain conditions were dissipating. Headaches were going away. Painful menses were going away. Sex was becoming better. Autoimmune diseases were going into remission. Really, really powerful shifts. And then also insights. It's no wonder I got cancer. I've been walking around with X, Y, and Z my whole life. And, finally got to the root of that and resolved that. And only now do I feel like I actually have a shot at recovery. So, yeah.
Yeah, that's really fascinating. I always find that when you've been practicing in this field for long enough, is you reach a point where your desire to help people makes you need to learn, kind of more advanced modalities. And, if you kind of reach a point of how far you can help people, it's a source of disappointment or frustration. And, and often it leads to discovering new ways to kind of break through some of those barriers.
Yeah. And some things, especially if there's an energetic component or a subconscious component to an illness, or at the risk of sounding a little out there, an ancestral component to a condition, those things are stubborn. And sometimes you do need to go into the world of your ancestors, or to the world of the realm of the spirit.
Yeah.
Just on a different plane, just to make that shift. I actually recently saw a client who lost her son. Her son died when he was 27 years old. And her sister also lost her son when her son was 27 years old. And their mother lost a son when that son was 27 years old, right? So, what do you do with that? What amino acid or vitamin do you take for that?
Right.
You don't.
Yeah.
You don't. It's futile. That's powerful.
Yeah.
That's you need to get a little shamanic with that one.
Right.
If you want to break that cycle.
Things beyond reason, right? They're things that there's no way you can explain it with our current just sort of left brain, right brain modalities. You kind of have to go to a different level.
Yeah. Absolutely.
So that's really interesting. So let's kind of go into the psychedelic medicine field. Why is it emerging? What problem is it solving? You sort of talked about it already, but I'd love to just kind of hear your sort of state of the field. Why are we here today?
Right. Yeah. Why psychedelics? Why now?
Yeah.
Well, we almost we almost had a psychedelic movement. We did have a psychedelic movement in the 60s and 70s, but it sort of petered out for a myriad of reasons. And so what we're in right now is a renaissance, where we have picked up where Timothy Leary left off, and rather than starting like a threatening counterculture grassroots movement, although that is happening as well, there is also this above board, evidence-based, scientific focused angle. And so I think part of why we're seeing more mileage now is, science and medicine are the religions of our culture. And now this medicine is speaking this religion. where we have science, we have people who have suits with short hair conducting studies on this stuff. But I think the reason that it's speaking so strongly to us now is that we are in a mental health epidemic. We are in an absolute crisis point. Depression is the leading cause of disability worldwide. Depression.
Oh, yeah.
How long have we been humans? Like, how long has the human race been here? Depression is the number one cause of our disability. And the tools we have are good, but they're blunt tools. And they don't, for many individuals, they don't go deep enough. And therapy is wonderful, but some people need more than 50 minutes once a week, to really unpack years and years and years of maladaptation to trauma.
And also pain, right? The kind of the recent opioid epidemic, and sort of the need for other pain alternatives. I imagine that's part of how psychedelics have emerged.
Oh, absolutely. And we know that chronic pain has actually very little to do with what's happening peripherally in the body. So for example, if someone has chronic pain in their shoulder, there may actually be nothing really wrong with their shoulder. There may have been an injury once upon a time, but chronic pain, it becomes like this nasty habit in the brain, where the brain sort of gets stuck on a firing pattern of registering pain when there actually may not need to be. And so a lot of the conditions that people face today, depression, anxiety, obsessive compulsive disorder, addictions, chronic pain, these reflect stubborn firing patterns in the nervous system, where the nervous system picks up a bad habit and then it repeats that bad habit. The more you practice a bad habit, the easier it becomes to do that bad habit.
Right.
So, when I was a teenager, my bad habit was I said every other word, and the more I did it, right? So it's just this stereotyped pattern of behavior that happens with a lot of these conditions. And so what we know about psychedelics is they temporarily disorganize the brain. So they interrupt those stereotyped patterns of behavior in the nervous system.
Yeah, and it seems the standard model for some of these conditions is you pair some type of SSRI or SNRI or MAO inhibitor with counseling. And I imagine when those two, what from my understanding is when that combo doesn't work, it's often can be due to sort of the inability to get to deeper places in that process. And you kind of also relive memories that could be painful to even talk about, even with a trusted counselor.
Absolutely.
So
absolutely.
Can we go into sort of the overview of the various therapies that are being used right now, and just sort of like a brief description of what they are?
Sure. Like a meet and greet.
Exactly.
of the MVPs. I say
if there's people from the 60s listening to this, they definitely are familiar with like LSD. That's
right.
And some of the other therapies, I think, just to kind of introduce our audience and everybody to sort of
Sure. Yeah. Well, I will say that what I'm going to be sharing is in no way an exhaustive list, because there are so many compounds and such little time. I will mention the book PCAL and the book TCAL. So PCAL stands for phenethylamines I have known and loved. And then TCAL is tryptamines I have known and loved. Those are by Alexander and Anne Shulgin. And those are really, really interesting books. They also include recipes for many psychedelic compounds that I hadn't even heard of before I read these books. So there are a myriad of psychedelics. I'm not going to talk about all of them. I will kind of talk about the ones that are like in the news that we're seeing a lot of emerging studies on.
Sure.
The first one I'll mention, just because we just had a study this month in Nature, a phase 3 clinical trial, is MDMA, methylene dioxymethamphetamine. That is the medicine that is sometimes people think that they are taking, they may or may not be taking it when they use the street drugs, ecstasy or Molly. And MDMA has shown incredible promise specifically in the treatment of post-traumatic stress disorder. That is where MDMA really shines. Now, are there other indications for MDMA? Absolutely. Couples therapy is very high on that list. And MDMA was resynthesized by Alexander Shulgin. It was then used by Leo Zeff and Anne Shulgin and other counselors and therapists in therapy. They were seeing remarkable results with this. But then what we had in 1985, in the United States, we had the crack cocaine epidemic. Mm-hmm. And then there was this very, very, very hard line drawn about drug use, and the war on drugs ramped up. You know, this was the Reagan administration. We had the Nancy Reagan just say no. And MDMA was moved to Schedule 1. Schedule 1 drugs are drugs that have no accepted medical use and are illegal. Mm-hmm. And MDMA was moved to Schedule 1 despite the fact that there had not, as of yet, not been any studies on that molecule, and that several psychotherapists testified in support of its use in therapy. Mm-hmm. So thankfully, there was a delightfully stubborn guy by the name of Rick Doblin, PhD, who wanted to fight that. And he started the Multidisciplinary Association for Psychedelic Studies in, I believe it was 1986.
People know that as MAPS, right?
MAPS. Yeah. Mm-hmm. And since then, Rick Doblin and the folks at MAPS have been working just tirelessly on raising money, funding studies, gathering clinical data on MDMA. And it's really thanks to them that we have the clinical trials that we have. The FDA has also recently approved the expanded access program, meaning that some individuals can now even receive MDMA outside of a clinical trial. So I think it will not be very long before we actually see MDMA rescheduled and before that medicine becomes legal.
Okay. And just for context, as we're going through these different therapies, most of the administration of this, and we'll talk about this later, when you're talking about this is sort of done in a setting where you have either a guide or a spiritual leader or even someone who's a counselor or two counselors. It's kind of, this is being used in a context of when you're under the guidance of a professional, right?
That's correct. Yes. So the data we have on MDMA, it's not MDMA. So I actually am going to correct myself here. It's MDMA-assisted psychotherapy.
Gotcha. Okay.
So what the MDMA does is it's almost like anesthesia in the sense that it allows you to dig and get to that painful part that needs to be healed. Parts that may otherwise be too guarded or painful to access in regular talk therapy. And so we see this in individuals with post-traumatic stress disorder. A lot of them can't engage in therapy because when they try to access the memory, they re-trigger themselves, re-traumatize themselves. You can actually make someone with PTSD worse if you don't know what you're doing. MDMA, and I just want to make it clear, by no means is it fun for these individuals to do this session. There are a lot of tears. Sometimes there's yelling, sometimes there's hitting, emotional releases. The MDMA makes it possible to do that work. And for individuals that frankly could not do that work otherwise.
I've heard it described that it sort of tones down the amygdala, but supports the prefrontal cortex. Is that a fair basic description? I'm sure there's much more technicalities to that, but
it turns down the fear response, and it also floods the brain with oxytocin, which is like that bonding love hormone. Right. So it has this nice combination of calming the person down. So it calms down their like anxiety and defenses, but it also stimulates the person without making them too edgy. And that puts the individual in what's called the optimal arousal zone. meaning they want to lean forward and engage and heal the thing without getting overstimulated. They're relaxed enough to not get overstimulated, but they're engaged enough to actually want to do the healing.
Yeah, that makes a ton of sense because, like there's so much body memory with trauma, right?
Yeah.
That
Yes.
if you feel those sensations, it might just shut you down. And
Exactly. Yeah. It's a beautiful molecule. I could not think of a better molecule to use as a lubricant for psychotherapy.
Wow.
Yeah. It's just what you can accomplish in 1, 2, or 3. In the studies, it's a maximum of 3 sessions. It was something that would take years, if not decades, of chipping away at in regular talk therapy.
Any downside that you tell people about before they sign up for MDA?
Well, yeah, people can't sign up quite yet unless they're in a trial. But the downside is, people tend to feel pretty crummy for about a week after they do MDMA. There's a big, activity at the serotonin receptors. So people tend to feel, maybe fine the next day, but the following day or the day after, they may feel tired or like they're coming down with the flu, or they may feel really sad, kind of blue. And typically people bounce back within 2 weeks, supplementing with 5-HTP and other supplements and antioxidants can help. And MDMA, is absolutely contraindicated with anything that affects serotonin levels. So that means SSRIs. If people are on an SSRI antidepressant, they should not be doing MDMA-assisted psychotherapy. They could put themselves in real harm. And MDMA, the A in MDMA stands for amphetamine. So let's not kid ourselves. This is an amphetamine. So a lot of the negative side effects have to do with that amphetamine edge, like the kind of the jaw clenching, feeling increases in blood pressure, increases in heart rate.
Gotcha.
That's the amphetamine. That's the unfortunate part of the molecule.
I see. Gotcha. Yeah. Okay. What other kind of go to next in your process?
I would say let's talk about psilocybin because it was recently legalized in Oregon.
Okay.
So I'm trying to think of what's in the news here.
Yeah.
So psilocybin, we don't have all that many studies on LSD in recent years. We have more on psilocybin. And part of that is because LSD just binds that 5-HT2A receptor so darn tightly. And anyone that's taken an LSD can tell you it lasts a long time. And so, often when I'm volunteering at festivals, supporting people having a difficult time on a trip, 9 times out of 10, maybe 8 times out of 10, it's someone who's on LSD. And they're like, it's been 10 hours. I'm still tripping. I feel like I broke my brain. I'm stuck like this forever.
Yeah.
And it's like, oh, no, sweetie. LSD can last up to 14 hours. You took a drug and the drug is working exactly how it's supposed to. So let's get you some juice and some art supplies because you're going to be here for a while. So psilocybin, on the other hand, less than 8 hours, typically 5 hours. And so psilocybin was recently legalized in the state of Oregon in the context of psilocybin-assisted therapy. So again, not just the medicine itself, but within the context of therapy. And it has shown wonderful promise in the treatment of depression and anxiety. And also we have some preliminary studies in smoking cessation as well.
And the psilocybin, I've looked a little bit into the mechanism. I've seen some stuff about Brain Derived Neurotrophic Factor, and some of the other areas it works on. Can you just talk a little bit about that? Because that one's big in the depression world these days. Because,
it is big.
Because of its just ability for you to sort of access resources in your brain and memories, positive feelings.
Yes. So I just want to give a shout out to Dr. Robin Carhart Harris who is a researcher in the UK. A lot of what we know about psilocybin and LSD's mechanisms have to do with his work in recent years, in which he has just performed brain scans, fMRIs of people at baseline and then while they're tripping.
Oh, wow.
And so based on that data, what we know a few things, actually. One way in which these classic psychedelics work is they, as I was saying before, they interrupt those bad habits of the brain. So certain conditions are associated with too much rigidity, too much order in the brain, depression, anxiety, OCD, addictions, compulsive behaviors like that. That's too much order in the brain. At the other end of the spectrum, we have schizophrenia, we have mania. That's too much chaos. That's not what we're talking about here, right? And this is why classic psychedelics may be contraindicated in individuals with a history of psychosis. But for people that have too much rigidity, I will also include, this is not a clinical diagnosis. Some people are just squares, they're just kind of like
lighten up a little bit.
Yeah, like there's no joie de vivre. And we also see this, it's like a lack of brain plasticity that happens in individuals. And this is me, I'm just running with my own idea here. There's like this lack of plasticity that happens with people as they age. And then we have like grumpy old man syndrome, right?
Yeah.
Like that is rigidity. And so what psilocybin, LSD, other substances that are, considered the classic psychedelics do is they interrupt that rigidity for a period of however long that drug lasts. It's not for your whole life. But in that time and space of like, let's say you lined up the marbles in a perfect row, right? And then psilocybin comes and knocks them off the table and makes a big mess. And in that time of having your brain disorganized, your brain can start breaking its habits, and it can start learning new tricks. And a part of how it learns new tricks is we have an increase in something called crosstalk. So what that means is parts of the brain that don't normally talk to one another start talking to one another. And this is part of why we have the dreamlike visualizations. They're not hallucinations. People refer to these substances as hallucinogens, and that's wrong. You don't hallucinate on these substances typically. Yeah. But you may have vivid imagery in your mind's eye or when you close your eye. And that could be because different parts of the brain are suddenly communicating with the visual cortex, right? And this is why we also see synesthesia, why, the sun can taste like purple and smell like Miles Davis, right? When you're on LSD. But those kind of fun, entertaining changes aside, your brain can also suddenly form an entirely new relationship with how you talk to your sister, or maybe it's time to forgive this person. Maybe it's time to call this person to accountability. Or maybe it's time to make a change in this way. Maybe it's time to open my heart in this way. And on a physical level, I'll share the story of Paul Stamets, who is a wonderful mycologist. He actually spoke at my med school graduation. He was a keynote speaker.
He's called the fun guy, right?
The fun guy. He wears a hat that's made out of a giant mushroom. He used to stutter, and it was on his first trip with psilocybin that his stutter was cured. He hasn't stuttered since. Right. And so what's a stutter? That's a bad neural habit. Right. So, and part of how that bad neural habit gets broken is there are some structures in the brain. They are not structurally connected, but they're functionally connected. And collectively, they're known as the default mode network, the DMN. And the DMN in certain conditions like depression and OCD, the DMN is too active. And psychedelics turn down DMN activity temporarily.
Okay.
Yeah.
Interesting.
Yeah.
And the safety profile of psilocybin, any
excellent.
comments on that? Yeah.
Excellent safety profile. Yes. There is no known lethal dose of psilocybin, nor of LSD. Neither are neurotoxic. You'll definitely flip out if you take too much.
Yeah.
Psilocybin typically, not 100% of the time, typically combines well with antidepressants. So this is another thing that I actually really appreciate about this medicine, is that if an individual is on an antidepressant, they may not have to taper off. Now, that being said, psilocybin seems to work better if you are off of an antidepressant, but it still can help. We do have this very, very rare condition that has been reported, where people kind of have the flashbacks, the hallucinogen. I don't even remember the name of it because it's so rare.
Yeah,
like hallucinogen persistent perception disorder. And it's where people kind of temporarily get taken back into kind of the more superficial layers of a trip, not necessarily the emotional quality of it. It is very rare, but it is a thing. We don't really know too much about it. More research is warranted there, but it has not been observed in any case of anyone who has been in a clinical trial or used these medicines therapeutically. It seems to be associated with recreational use.
Okay. And so you're saying it's now legalized in the state of Oregon. So that doesn't mean like doctor calls a prescription into Walgreens, right?
No, that's a good question.
Yeah. So
no.
What's the process these days to be
Sure.
authorized to use it or prescribe it?
Well, we just passed it in Oregon in November of 2020, and now the state of Oregon has 2 years to figure out how the heck they're going to administer this new program. So in 2 years' time, you will be willing to, you will be able to go to a facility that has some kind of a permission slip or a certificate from the state that is a psilocybin therapy facility. Meet with a facilitator, have a session of talk therapy or an intake, and see if you're a candidate. Come back, or it could be the same day, actually take the medicine, and you take the medicine on site with the facilitator present with you. You do not get to take the medicine home. You take the medicine on site. You are supervised while you're there. And then you go home, and then you're invited to come back for at least one integration session. And something that's quite interesting about Oregon's program that I love, but that is very controversial, is you do not have to have a diagnosis.
Okay.
So you could just come into one of these centers and say, hi, I'm in perfect health, and I'm just really curious about this medicine, and I'd love to have a mystical experience if I may.
Right, like for personal development or growth, spiritual growth or something along those lines. Gotcha. Yeah, I mean, I think there's, with the emphasis on like brain nootropics and brain performance and people really learning a lot about how their brain works, it makes a lot of sense that there shouldn't have to be a, kind of medical diagnosis to safely practice or experience assisted therapy with psilocybin.
Yeah, to have a spiritual or mystical experience.
Yeah, I mean, some people are doing this anyways, like by either by just experimenting by themselves, or they're going on trips various to like Mexico or Peru or other places, right?
Exactly. And we recently passed another law in Oregon. It was ballot measure 110, which actually decriminalized pretty much all drugs. So now, it's not legal, but it's not illegal. An individual in Oregon can have, I believe, up to 12 grams of dried mushrooms in their possession. And the worst thing that'll happen is you have to pay $100.
Oh,
so
okay.
Yeah. So that's good news and bad news. It means that a beautiful age-old medicine is now, no longer criminalized, but it also means that some people are kind of just trying it at home, and results may vary,
Right.
When you blow open your consciousness and open the cellar door to your subconscious and your psyche, stuff can get intense. It can get weird. And so it makes me nervous, to be honest.
Yeah. I mean, I think, we went through a similar thing when cannabis was legalized, but maybe on a lower lesser scale, but it was, but it's really interesting to see what surfaced is that even to this day, experts are sought after to help people make decisions and safely, kind of use CBD and use it in the way that's directed towards, or cannabis, I should say, in the way that's directed to their therapeutic goals. So
absolutely.
But there's this kind of awkward...
A side note, I think it's absolutely ridiculous that NDs cannot write for medical marijuana cards. Like, hello, we actually know about botanical medicine.
Right.
I can prescribe OxyContin to somebody in Oregon, but I cannot authorize a medical marijuana card.
That's really odd.
Come on. Yeah.
Luckily, we still have that ability up here in Washington.
Okay.
We still can authorize cannabis, but it's interesting. I mean, on that note, I'd like to say that, cannabis is considered in this kind of world too, right? The psychedelic medicine world.
It's funny. Some people really, really want it to be included, and some people really, really don't want it to be included. And it's kind of funny. you can kind of, there is like a bit of a, I wouldn't say it's like a strong divide. It's not like a war or anything, but yeah. And the same goes for MDMA. Some people are like, oh yeah, MDMA is not a psychedelic. It's an empathogen, an entactogen, but it's not a psychedelic in the true sense of the word. But these are all medicines that alter our consciousness, right? And cannabis definitely has a dark side. I will say it's not my favorite for psychospiritual healing for most people. The way that a lot of individuals are using cannabis, I actually see it as a numbing agent, frankly, but not for everyone. Everyone's wired a little differently. And cannabis can also be a great adjuvant for therapy for some individuals,
Yeah. So I'm really interested to hear your take on ketamine. That one gets a lot of publicity these days, and we're talking about low dose ketamine. So, right. I just want to be clear that I'm using the term properly.
Well, what I do with my patients is I do it all kinds of ways.
Oh, okay.
So I kind of, I don't know if you've ever seen the movie Forrest Gump. There's that part where Bubba is talking about all the different ways to make shrimp,
Yes.
Like, you can make shrimp scampi, shrimp stew, you can saute. And that's ketamine, baby. Like you can snort it. You can inject it in the muscle, under the skin. You can inject it into the vein. You can hold it under your tongue. You can take an oral capsule. You can take it rectally. It's like, could you in a box, could you with a fox?
Wow.
There is a route of administration and a dose range for, I don't want to say everyone, but for many people, many different ailments.
Wow. Why is that? Is that just because is there something like unique about ketamine that makes it so diverse in its route of delivery?
It's just, pharmacologically, ketamine it's not super bioavailable orally, but if you put 300 milligrams in a capsule and swallow it, it'll get you there. Okay. And ketamine it's the most popular anesthesia drug worldwide. It's on the WHO's essential medicines list. And it is not without its risks, but it overall has a very, very good safety profile. And that's why it's also used in pediatric procedures, both, inpatient and outpatient, including dental procedures. It's used in veterinary medicine. And so, if you give somebody a high enough dose, right, they'll pass out. It causes amnesia and analgesia. And it also causes temporary paralysis, which is really important for surgery. You don't want people kind of wiggling around unconsciously on the table. And, one of the dark sides of ketamine is it is a date rape drug for this reason. But at lower dose, if you go lower than your anesthesia dose, ketamine can actually engender a very, very vivid psychedelic trip, very similar to ayahuasca. In my experience, it's only about 75 minutes long. Okay. And ketamine is a dissociative anesthetic. So it's kind of a weird trip where you don't really feel like you're in your body, and it's hard to move. It's called being in the K-hole. But ketamine has likewise shown incredible promise for depression. And one of the remarkable things about ketamine for depression is, let's say I had a patient who was so depressed that they were actually suicidal. Mm-hmm. If I put them on an antidepressant, I would have to wait 2 to 3 weeks to see if it was working for them.
Right.
Ketamine, within a couple of days. Sometimes it's within hours that you can abort suicidality with ketamine at the right dose. And to be clear, you don't have to do it at the psychedelic dose range, but guess what? It works better if you do.
Okay.
It does. It just does.
Yeah, and I've heard it lasts like even up to a week, the effect of that session. Is that right? I mean, that was right. Old data maybe, but
so it was about somewhere between 5 and 7 days. Yeah, is what I've observed.
Well, and I think anybody who's been around suicidality and that kind of the levels it goes to break a cycle is such a key intervention, right? I mean, huge. because things could change, like as far as from those 5 to 7 days that could end up steering someone to not go down that road again.
Yes. Yeah, I recently had a colleague who, this pandemic the COVID-19 pandemic has just been horrific for mental health, with the way in which we have bullied and shamed one another as individuals have sought out connection and human contact. And so, guess what happens in isolation? Mental health unravels.
Yes.
And so, so many people have been suffering during this pandemic. And so I had a client who had, I had a colleague who had a client. This client was so suicidal that he referred her to go to the hospital. And the hospital, they're working with limited staff. They're working with limited beds. They kind of need all hands on deck for the pandemic. So they sedated this woman and restrained her. They tied her arms and legs to the bed and left her for 12 hours. And it's like, well, darn, they could have just given her some ketamine.
Right. Yeah.
And then watched her for an hour and then reassessed. But so, slowly the conventional medical model is seeing the merits of ketamine. And we really have the subsidiary of Johnson & Johnson, we have Janssen Pharmaceuticals to thank for a lot of that data. They are making a ton of money as a result of it, but they put millions of dollars into clinical trials on ketamine. Yeah.
So before we leave ketamine for now, you could just speak to a little bit about how it works, like what's it doing in the brain?
Yeah, so ketamine works quite a different mechanism from most of the other psychedelics, and quite a different mechanism from most of our other antidepressant medications, most of our other psychiatric medications. Let me say this. We know how ketamine works for anesthesia. We don't entirely know how it works for mood issues. But what we know from the world of anesthesia is that ketamine strongly affects the NMDA receptor, and that has to do with glutamate levels in the brain.
Okay.
So by altering glutamate levels, the theory is we have our antidepressant effect there. Ketamine also increases synaptogenesis in the brain, and by way of BDNF and mTOR and other pathways, it sort of stimulates, the theory is like a domino effect of reactions in the brain, that we have increased neural plasticity. So something I want to say here about ketamine is, if you give someone, you can give ketamine in all kinds of dose ranges. I have people who microdose it daily as an antidepressant. I have people who take kind of a low dose during therapy, because that dissociation lets them engage in therapy. And then there are individuals who do the really high dose. And when an individual's on a really high dose, they can't talk. They're in a K-hole. They're going to slur their speech, and it's going to be annoying for them to talk. But if you get that person back into either your office or a psychotherapist's office within 48 hours, ideally 24 hours of their ketamine treatment, they've got this beautiful window of increased brain plasticity.
Oh, wow.
Where you're going to go so far with them in therapy.
That's so amazing to think about, because, for anybody who's struggled with a mental health issue. You kind of have like, you wait for those breakthrough sessions with your counselor where it's like you finally have that space to make like a change. Those are so few and far between usually that's why there's like a big dropout in counseling. Just standard counseling is just because it's like, oh, I don't really think I'm getting anywhere, and
right.
It's like really interesting to think of, having some assistance of getting to that place where you get to make core changes.
Yes.
But I also can imagine that someone who goes through something like this therapy, just because I've done different things, like I've never done psychedelic medicine before, but I went on a vision quest once.
Oh, wow.
And I remember, like, thankfully the organization I did it with said that when you get back to your community, you're going to have a person to meet with once a week, just to kind of downgrade from that experience you had, and kind of like reintegrate into your current world. Because if you just like get dropped off back in the hood where you're from, and you just had this like amazing experience, it's like really scary.
Right.
To kind of, you're just different. And I just was wondering if so how does it work? Like, can you kind of explain the model of how this would work, and just maybe talk about how that component, like after someone's gone through some psychedelic-assisted psychotherapy, like how are they reintegrated into their life?
Yeah. Well, as you said, it's not like just we drop you off at the corner, have a nice life, and you're fixed now.
Yeah.
And I think this is part of why we see frequent flyers, people who maybe continue to use psychedelics more frequently than maybe they really should be, or that is good for them. So ideally, the psychedelic experience is treated like a catalyst for further healing. And, as I said, all of these brain changes that happen in the psychedelic state, so far as we can tell, they're temporary. You take psilocybin, within 8 hours, you've stopped suppressing your default mode network, and the brain crosstalks goes back to how it was, before. The new neural pathways die, or they don't die, but they don't endure. The way that they endure is if you practice, right? It's like a muscle that you build. So this is how incorporating a mindfulness practice, a meditation practice, incorporating exercise, engaging in therapy. The other thing that happens during these experiences is data comes up for reconciliation and for processing. And you may or may not complete that reconciliation process during your psychedelic trip. Many people don't, in fact. They kind of just open the box and start the work. And so, it can then be very, very helpful to then take that information and that data from that experience to somebody who specializes in psychedelic integration counseling, or if you can't find such a person, then just a regular therapist or counselor, and say, okay, I'm ready to talk about what happened when I was 9. Wow. Or, okay, I'm ready to talk about how I actually perpetuated this cycle of abuse within my family. Or I'm ready to look at why I did that to my cousin when we were kids, or whatever the thing is,
Sure.
Yeah,
it's like the prefrontal cortex kind of goes offline, right, with these experiences. And, with just for the layperson, that's kind of like a part of your brain that sort of helps kind of organize and map out like sequence and recall, and organizing an event or an experience would likely depend a lot on the prefrontal cortex being on board. And so it's really interesting to think that, like, you can kind of, once you can talk about something, that means that your prefrontal cortex is engaged.
Right. Well, and also part of it is the default mode network. That default mode network has a lot to do with ego, has a lot to do with the story about who you are. Oh, I'm this kind of person, I'm not that kind of person.
Yeah.
And that default mode network, it lights up when people like something you post on social media. It's like a greedy little golem. And so to just get a break from that DMN activity, there's a lot that suddenly you can focus on.
Yeah.
You know,
Yeah, that's
and we do need our egos, right? You know, the ego tells you, it's like, oh, which hole do I put the food in, right? You know, it keeps you alive. But you know, it can also be a little bit of a trickster.
Oh
you
yeah.
know? Right.
That's really interesting. I love that's a completely new thing to think about, like the DMN for me, because like that's just not a network that I've really studied, and it's fascinating just to kind of think about how much more that adds to the picture, you know.
Right. And I will say it's a relatively new theory in, you know, neuropsychiatry. So, you know, maybe in 10 years there'll be something that comes out that says the DMN doesn't exist and everyone was wrong. You know,
yeah, that's life.
Right.
That's the nature of science, right?
Right.
It's the way it goes. But well, this has been delightful. I really enjoy speaking with you and hearing and learning. I took like pages of notes here just talking with you. It was just really fascinating. So I'd love to kind of hear more about what you're up to professionally and how people can follow you or maybe learn from you, and any kind of closing thoughts or kind of wisdom you could leave us with.
Yes, absolutely. Well, first and foremost, I want to mention that I have if I say so myself, pretty stellar online course on psychedelic medicines. Okay. It's called The Science of Psychedelics. So if you go to scienceofpsychedelics.com, you'll be able to see the course there. CME is available for physicians, as well as CE for other types of healthcare practitioners. And I would actually love to offer your listeners a discount.
Oh, thank
you. For signing up for the course. So I'm putting you on the spot here, Doc, but what would you like your coupon code to be?
One thing.
Okay.
Yeah. Like
so if you
the word one and the end thing. Yeah.
So ONETHING. Okay.
Yep. Thank you.
So one thing will get you wonderful listeners a discount on the course. Would love it. I definitely put many hours into that, and I have modules on all the medicines we just talked about, as well as I also talk about ayahuasca and ibogaine and microdosing. There's an entire module on the psychedelic treatment of addictions, and some basics for trip sitting. It's really, I mean, I gotta say, it's a really darn good course.
Well, congratulations. Those people don't understand how much work those take.
Oh my gosh, so much work.
I can't even,
say. Especially, pardon my interruption, especially if you want it approved for CME. Oh my goodness. Yeah. Is the ACCME strict? Holy cow.
Yeah.
So there was a lot of back and forth there, but we got it approved. And then I'll also mention my website, just drzelfand.com, my name.com, where you can read more of my articles, listen to more podcasts. I do consultations with people all over the world through online and phone. And I obviously cannot, tell you to do anything that is illegal where you are, but, harm reduction is important. So, sometimes individuals this is a route they want to go down, and they're wondering if it's a good idea, the risks and the benefits, which medicine, what dose, things like that. I love talking to people and healthcare providers all over the world.
Excellent. And any closing thoughts that you want to just share with us about what we discussed today?
I don't know why this is coming up right now. I might regret this later, but I was recently sitting around with some other practitioners who do this work. I will mention that I'm actually in Mexico right now working with ibogaine, helping people get off of opiates and other substances of abuse and addiction. And so some of the practitioners and I were sitting around, and we were like, what's like the best way to tell somebody to receive a psychedelic experience, And Bill Richards came out with this whole list called the flight instructions, which I highly recommend looking up. Be curious. We all agreed was very important. Be curious, like no matter what comes up, like, oh, this is so painful. Be curious about it. Be curious about that pain. And then there was also this one, which was, I'm of course blanking on where it came from originally, but it was sit down, shut up, and listen. So I guess I will leave with that very bizarre parting advice.
Those are like that applies to life. Those two right there. I mean, we're all on a flight.
Right.
Those two principles. I mean, I can work on those, and it probably will improve my life and ability to fly and receive this life.
Yeah. Cool. So I think the most important part of that is be curious. Just be curious.
That's awesome. Wow. Yeah. Well, this was really fun. Thank you for your time, and good luck on the course. It sounds just like an amazing course, and we will put all the links up to everything that you mentioned, and share the code with our listeners.
That sounds great.
All right. Well, enjoy Mexico, and hopefully we can catch up sometime down the road. Whenever, kind of the new thing comes about or new things to learn about.
That sounds wonderful. Okay. Thanks so much, Doc. This is really a pleasure.
You're welcome. Thank you.
Okay.
Thank you so much for tuning in to this week's episode of the One Thing Podcast. Please share these episodes with your friends, loved ones, colleagues, patients, healthcare providers, anyone who you feel might benefit from hearing these informative interviews. We tend to learn best from people sharing things with us. That's often the first time it's introduced. So don't hesitate if the content of these episodes reminded you of someone that might benefit from that. Forward the episode to them, and I'm sure they'll either appreciate it or be appreciative that you've thought of them. So once again, we'll look forward to seeing you next episode on the One Thing Podcast. And again, much appreciation for you being here with me.